Hi, my name is AJ Holmgren, and I'm an assistant professor of medicine in the Department of Medicine and the Center for Clinical Informatics and Improvement Research, and an affiliate faculty member at the Philip R. Lee Institute for Health Policy Studies. My research examines how patients and physicians use information technology and digital tools in the process of delivering and receiving care, and how we can better use technology to improve health. One thing I've been thinking a lot about lately has been how COVID changed how we communicate. That includes how patients talk to their doctor. The most obvious example here is telehealth, having a healthcare visit from the comfort of your own home on a Zoom screen instead of having to go in physically to a doctor's office, which the popularity of which has absolutely exploded since the early days of the pandemic. The second, and perhaps less obvious way that COVID has changed how healthcare providers communicate with their patients is the use of online messaging through a patient portal. This capability has been available to patients for a few years now, and it basically boils down to a secure email with your physician. But so far, uptake has been pretty low until the past year. Whether it was fear of catching COVID or more awareness of the feature as telehealth exploded in popularity, patients have been sending their doctor far more messages after the onset of COVID than before. This can be great for patients. It's super convenient to type up and send a quick email to ask a question or get medical advice or ask if you need to come in and visit the office, rather than calling and waiting on hold for a physician to be available or schedule an appointment for potentially weeks away. For physicians, however, it's a new source of work that they need to find time to do in their busy schedules. They need to read those messages and oftentimes respond. And for many physicians, this is not compensated work. Most payers, insurance companies, and Medicare don't allow billing for secure messaging with patients. In a recent project, I partnered with one of the largest health IT companies in the United States to measure the volume of this increase and the impact it has with national data on 350,000 physicians in the United States. We found that patient messages for medical advice rose 150% compared to the pre-pandemic period, and this drove an increase in time spent working on the computer for physicians. Each additional patient message took on average 3 minutes of physician time. When you start measuring how many of those patient messages there are and they start adding up, that starts to look like a pretty serious time investment for each physician. The policy implications of this are really important because physicians are already incredibly busy. And just like any other job, if you have to run low on time and try and decide what to prioritize, it's going to be what you're paid for to do. The ability to secure message with a physician could be a really useful way to reduce overall healthcare spending by replacing expensive in-person doctor's visits with inexpensive messages, allowing physicians to focus on their sicker patients. And if we think that's the case, we should design reimbursement systems to reflect that. It's important to design systems so that physicians will be compensated for the work that they do and the work that we as a society value, so that health systems will have an incentive to carve out time for those doctors to spend messaging with their patients, and so that patients will retain access to this new method of receiving care and speaking with their doctor that they seem to really value. This is a really great highlight of where my research focus is, how people use technology, but more importantly, how policy and management shapes how we interact with that technology. Whether we keep or not the ability to secure message with your physician conveniently wherever you want as an available tool for most patients isn't a technology question, it's a policy choice. And that's what interests me.